The project that we're working on is utilizing barbershops in the Worcester area to serve as a place to educate, screen, and refer these men of color to providers in the area.
We're just trying to create a culture competent model so that we can get some positive reaction to men to be receptive to go back into getting physicians and taking care of themselves.
Healthcare disparity is a problem for all Americans. Amongst that population, men of color, especially Hispanic and African Americans, have the worst healthcare outcomes. The biggest misconception is to think that many of these guys just don't care. And most of the conversations we have in here, they're very concerned, but they're not sure how to ask those questions. And the key is the relationship. And that's what we're doing right here. We're building a relationship so these guys can get their needs met. They can see primary care doctors.
So you have people from this population that use the medical institutions, the emergency wards, as a way of going to get checked. So if we can actually reduce those numbers and connect them to the Barbershop Health Network, those are the things that we're working on to do with the whole formalizing the partnerships with all these medical institutions.
Well, come in here and just spread the knowledge, and then, maybe that person will take more care of their health.
People get comfortable when they see people that look like you sometimes. Does it mean that they're culture competent? In some capacities, yes. In some capacities, no. Having that cultural competency is being able to really be sensitive and to be able to make that patient feel welcome. So we want to change the way that we actually work with the medical professional as well as working with men and families in the urban community. That's what we like to do at Barbershop Health Network.
What we have here is a barbershop tournament / health fair. The barbershops that are associated with this pilot project, they're going against each other for pride, but it also gives us an opportunity to get some of these guys out and do screening. We're screening for diabetes, we're screening for hypertension, and also mental health.
Number 62.
Something just as simple as basketball is bringing everybody together to want to know what's up with BHN. It was probably the most competitive tournament Worcester have seen in a long time. It brought out a lot of the greats that used to come through Worcester.
It's been a buzz since last year, since we took the trophy home. I mean, from Facebook, Twitter, seeing people in the community, everybody was going to be here today. Definitely a bigger event than it was last year.
It brings the competitiveness out with like the whole community of each barbershop. It's a good thing because now the fans, the people who come to the barbershop, their families, they all come out to support the barbers.
When you're looking at obesity and hypertension and diabetes, men are not going into those medical centers, and not men that we're working with. So what we find that the Barbershop Health Network has an innovative, a unique ability, because at one point the barbershops were used probably 50 to 100 years ago as a social service.
Barbershop has always been that center for information. This is one of the places that everybody feels comfortable. It feels like it's home. You become family with a lot of these clients.
Some of them talk to us about their life, how they're doing in their life. And we got the privilege to listen to them and give them that support.
It just becomes like a little community, and they come sit in your chair. It's almost like a therapy session. They tell you about their family, their life, health issues, whatever it is that they want to talk about. It gets rid of the barrier that kind of wedges people from wanting to talk about health, because they can talk about it with somebody that they're comfortable with.
Barbershops, especially the type of people that we're trying to reach out to, is probably the best choice to reach out people and raise awareness and explain to them and open their minds out. People come here just to interact. People come here not to even get a haircut. They come to just talk. It's much more than haircuts here.
These guys are community health workers. We invested through our partnership with Master Department of Public Health and had them really trained up for outreach in health education.
We try to establish some type of relationship, some type of trust. When we come back again, you know, this person's gonna remember me. This person might pull me aside and ask me some questions that they might not have asked me if they had just first met me.
It's bad. You like to fry a lot of things, use a lot of bad ingredients.
A lot of the people in the barbershop, especially a lot of men, we find that they lack a lot of awareness and knowledge of the diseases that are out there, especially like diabetes and prostate cancer. How important it is to eat right, exercise. We don't actually have to wait till we're in pain or bleeding to actually access healthcare.
It's difficult because you kind of got to know when to shut up and, you know, and when to pick and choose what's a good talking point. They're my concerns, they're my issues. So for instance, you know, we're addressing health disparities amongst men of color, specifically Black and Latino. I'm just going through the struggle. I'm going through the same issues that they're going through, and I kind of, you know, so to speak the same language.
The jargon, a lot of the stuff doctors talk about, people couldn't even begin to fathom. And just the language itself is kind of a barrier that's hard to break. Just giving a little education. We're doing diabetes and prostate right now. So it was a great idea when we first thought of it to go into the barbershops and let's start reaching these people who don't necessarily go to the doctors, but they like to look good. They like to get a shape up. They like to be in that whole family atmosphere. And then you have a barber who's going to sit there and say, all right, how's the family? How are you doing? How healthy are you? You know what I mean? You know, diabetes is killing us and stuff like, you know what I mean, so forth and so on, to kind of add value to the relationship.
I learned that there's a myriad of issues of why people aren't going to the doctor or even taking care of themselves. It could be something like they don't have insurance. It could be something like they don't have time. They're working 2 jobs and they're raising kids. They had a bad experience. When they go to the doctor or to the clinic, they're engaging in a destructive lifestyle. It could be something simple as they just don't know. It depends on the individual.
I see this turning into something real great. It kind of brings back the value of it takes a village to raise our kids. And that's pretty much the key of this, is to kind of have that vision of bringing the togetherness back.
We need to actually get together as a community and support each other, give the guidance and information to those that need it. And there's no reason why we should be dying with the numbers that we're dying.
One of the things that we would like to see is to let the medical institutions understand the importance of this model and understand how they feel when you come from a community that's been stereotyped or racially profiled, how we make sure that our medical professionals are giving us the quality and the quantity of services that have the ability to make that patient feel when they came to that doctor, they got what they need.
It single-handedly changed my outlook on medicine. A lot of times we're talking about the factors, we're talking about the barriers, we're talking about problems. What Brenda and her team are doing is really saying, here's a solution. Here's a way to really make a change, not only in Worcester, Massachusetts, but something that could be replicated throughout the nation.
If you care about the advancement of human beings, make sure that we're all taken care of health-wise.
These are perfect push-up forms, as you can see. The muscles and the veins popping out. That's real good form.
One second, Ryan. Excuse me. We're doing an interview. Could you not do that in here? that better be the mayor or the governor. I don't know why that's so important to take. I'm sorry. Go ahead and ask that question again, Ryan.